YouTube.
3, 2, 1. You guys are live.
All right, all right, all right. Hello, everyone on YouTube and my Facebook Live and Dr. Huang Live's Facebook. So, first, I would like to do a little introduction. Um, so, let's get it going. So, welcome to today's episode of Security Tales. I'm your host, Felipe Montero, and I'm thrilled to have Dr. Winnie Wong on from Radiant Medispa in Winchester joining us today. We're diving into the fascinating world of fillers and Botox. Dr. Wong brings a knowledge of wealth and experience, expertise to the table, and will explore how these treatments can enhance beauty and confidence, as well as the important safety consideration to keep in mind. Whether you're curious about the procedure themselves or want to learn more about their effects, you're in for an enlightened conversation, everyone. So, once again, I'd like to introduce Dr. Winnie Wong, also my wife, that did not take my first name, but we'll discuss that later. I'm sorry, last name, last name. This is why she's my wife. Well, you never know. There's never too many Felipes. So, hello, Dr. Wong. Welcome, welcome. And I hope you're ready to have some questions asked today.
Yes, I am. Thank you for having me.
So, are you well today?
I am well.
Excellent, excellent. Did you get some gym time in?
I did.
All right, I'm glad to hear it. Well, let's just start off. Let's get everyone going. And today there's an inauguration, so I respect and understand a lot of people are watching that. But thank you so much for joining us today, if you are. So let's just get started. So once again, I have to refer to her as Dr. Wong out of respect, as not my wife. It's Dr. Wong. So I came up with some questions that I was always personally interested in, and some friends of mine, because Botox is not only for females, it's also for males now. So I don't want to hear any boos or yous from my guys. All right. So, first of all,
We call it
Brotox. There we go. You heard it first. Brotox. So, Dr. Wong, I want to talk about your personal experience. What inspired you to start working with Botox and fillers in your practice?
Well, Felipe, I also am a family doctor, a general practitioner, and I deal with all ages, men and women, children, elderly. But I really, really enjoy procedures and working with my hands. But I also have an artistic background. If you come to my office, you'll see I have my Chinese paintings hanging in the waiting room. I really enjoy art. I have a craft room at home, which I know you love, with all my papers and projects and ribbon and markers and everything. So I just love creativity and I love art. So when I work on someone's face, it's like I'm working on a live sculpture, like it's a live piece of art.
Excellent, excellent. And that I can advise you all that she is an incredible artist to the point where I've done a tattoo of my back is dedicated to her, and she actually drew the whole piece. So after I get 1,500 viewers to follow on YouTube, we will show her masterpiece on my back. So great, great. I love that. I love that. So listen, I want you to explain some of the key benefits of Botox and fillers that you think people should know.
Well, I think obviously most people know that Botox and fillers will help people look younger, rejuvenated. Did you want me to talk about some like off-label or other uses for it? There are medical uses I think people might not know about, which I personally don't practice, but maybe people don't know. So it's treated to for migraines, TMJ, like if you grind your teeth, if you have torticollis, so like a stiff neck. And did you know that you can even use it for bladder incontinence and to treat anal fissures? So basically,
Jeez, no, I did not.
yeah, so basically we can use Botox anywhere on the body from head to toe. It's a nerve toxin. And actually, I learned something interesting last year from unfortunately one of my patients who had vocal cord paralysis from a surgery when they were intubating. You can use filler to reconstruct the vocal cords to help support it. Did you know that?
No, I did not. That's why you're here.
Yeah.
We did not know. So let's go back a little step. So there's some stuff. Obviously, I developed some questions for you, but I found something interesting. Is there an age limit on Botox and when you can use it and why you should use it?
Oh, that's an interesting question. I don't think there's any age limit. I have, well, I mean, I wouldn't treat anyone under 18. I mean, I think my youngest client right now is 20 and my eldest is like in their 80s. I think it's whatever people are looking for to help them feel more confident. So I don't think there's any age limit. I do think that the earlier you start, you're going to need less and less as we go on. And that's something we can touch about later.
Okay, great, great. I appreciate that. So, one of the things that I wanted to know is your results. From your experience, how satisfied are your patients with their results? And how do these treatments enhance their self confidence and esteem?
I'd say my patients are really happy with their results. I can think of two particular cases. One time I had this woman who was in a postgraduate program and she was in her, I think, 40s, but she said she felt like she was being age discriminated because the other people in her class were in their 20s. And she felt like she always was never getting called to do group activities and everything. And when she came in, I always ask people when they come in for the first time, I say, what brings you in? What are you looking for? And to me, she said she felt like she wasn't part of her class. And that was kind of sad for me to hear. So I treated her and she came back a few months later and she said she just felt so much more confident. She felt better going into class and she felt included. So that for her was outstanding. Then I had this other lady, when you're asking about age, she was widowed and in her 70s. And she came back a few months after I treated her with Botox and fillers, and she was literally crying. She said she finally felt confident after 10 years to go on a date.
Wow, that's dramatic, and that's definitely impressive. So let me ask you something. It was pretty interesting that you brought that up. Do you feel um, that when people come in, their self confidence is now established more because of the treatment you provide? And if so, how would you be able to tell the difference of who needs Juvederm? I'm sorry, fillers, not Juvederm. My apologies. Fillers from Botox, and what's the difference between them both?
That's a good question. And it's okay that you said Juvederm. Juvederm is a class of fillers. So I use several types of fillers. So I just didn't want to say just Juvederm. And Botox is a type of neurotoxin, but that is the only neurotoxin that I'm currently using. So I do get that question a lot because people come in, let's say, oh, Dr. Wong, I want Botox here and in my nasolabials. I'm like, no, that's not where you use Botox. So the simplest way I describe it is Botox is for lines that are caused by muscle movement. So I explain it as like folding a piece of paper over and over. So when your muscles are moving, they're creating these wrinkles like folding a piece of paper over and over. So, like your forehead lines, when you raise them, eventually by moving them, these lines will develop. Whereas filler is to help for loss of volume. So as we age, unfortunately, we start to lose fat, hyaluronic acid support, and so filler would be replacing that. So I kind of describe it as like if you have a mattress pad and it starts to get worn, you need to fluff it up a little bit.
Okay.
So,
So I'm not gonna lie, those were more than two syllable words, and I'm not gonna lie, that kind of okay, but there was other words you used that was much larger, and I just don't want to look like someone that's doing like frozen face. So when you're saying it stops the drooping or something like that, how do you know when there's enough to place in? Is it by your years of experience, or do you feel it's just because you're so well versed in facial muscles and things?
well, it's a couple of things. Yes, I would say that injecting a lot of people. I've been injecting since 2006, and every week.
Whoa, whoa, whoa. You said 2006?
Yeah,
So we're talking 18 years?
that's pretty good math. Yes.
Why, thank you. I know you're impressed by that. 18 years you've actually been in this field where Botox was founded in what year?
Well, cosmetic Botox was founded maybe I would want to say like 8 years before that, and I actually had the pleasure of meeting Doctors Carruthers, who invented medical Botox. I was so excited. I met them at a conference a couple of years ago.
And I would like to say you stalked them at the conference and went running up to them, and you were the only one that knew who they were. And you made me take pictures of you and them, which was great because they were the founders,
Yes,
right?
so they are my details, I have their Botox book that they came out with, like I think back in the late 1980s. They have multiple editions since then, but I've studied that book inside, backwards, and forwards. And so when I didn't know they were going to be at the conference, and when I heard them ask a question, I was so excited I had to meet them. But it was really sad that there are a lot of young injectors out there who weren't excited because they had no idea who they were.
Okay. Okay.
It's like you being a boxer, you not knowing Muhammad Ali.
True fact. Catherine White just jumped on, and Catherine White just made a comment live. She just said, "I'm a patient, and I am always happy with my results with Dr. Wang."
Oh, thank you, Catherine. I
So,
really appreciate it.
yeah, and that's great. Thank you so much, Catherine. Well, I refer to Catherine as boss lady because she was my ex-box and boss, and she's an excellent individual, and I love to have her in my life.
I
So,
would like to be boss lady too.
okay. Well, the title was already given. So let's go back to the natural look because I remember you always phase a natural look into your work. What techniques do you use to achieve that while still providing effective results?
So there's a couple of things that I do. So first off, if it's your first time getting injected with me, I always encourage a follow-up. And also I educate people that this is a relationship we're going to build and it's a journey. So it's not like you come in one and done.
Okay.
So I always say when you're coming in for Botox, I want to see you back in 2 weeks. And I have this philosophy that less is more. We can always put in more Botox, but it's once you put in too much, there's nothing you can do except for to wait for the results to wear off, which can be 3 to 4 months. The same thing with fillers. The great thing about fillers, and I brought a little in to show you, Felipe. So
Great.
it's a gel-like substance. If you want to put your hand out, I can squirt some on you so you can feel it. So it's a gel, and unlike
Oh yeah,
yeah,
feels like a lubricant.
yes.
Right, Robbie the robber? Robbie the robber needs some on his hand. After you leave, okay, we got you. We got you.
So anyway, with fillers, even though you can see the results right away, I have people come back in about 3 to 4 weeks because it takes about 3 to 4 weeks for all this any swelling or anything like that to go down.
Okay.
So first off is I take the less is more approach, reevaluate, have them come back in a few weeks.
Okay.
The second thing is, yes, because I've been injecting for so long, I would maybe a pearl of wisdom that I would give to new injectors is inject, take pictures, have people come back in 2 to 3 weeks to see what your results are like. So you really get to understand what your placement does and you can see the effects of that. The other thing is when I inject filler, a lot of times people come in, they tell me where they want it placed, but I have gained some confidence over the years of injecting, realizing I'm the expert and I have to tell patients. So oftentimes what happens is they'll come and say, Dr. Huang, I don't like my nasolabial folds. I want filler here. And back in the day when I first started, I might be like, okay, sure, I can put filler there. But now I take the time to really educate my patients and explain to them. I brought some maybe some photographs to educate here.
Okay.
So
please feel free.
Okay. So what happens is as we age,
let me know if you guys can't see this. I can move whatever.
As we age, we go from this picture of
Can
our
you hold
face,
it up a little? There we go.
where it's an upside down triangle, and as we age, we become this triangle. So you can see our face falling. And the reason our face falls is because we have these fat pads in our face. So this side is the older side, and you can see the spaces.
Yes.
And so there's less structure. So when people come and they say, Dr. Huang, I want my nasal labials injected, which are these folds, I say to them, but the reason why you're having this is because you're actually losing support in your cheeks. So I educate them and say, if we kind of lift and support here, that's going to give you a more natural look.
Great.
And if you just go right to filling there, sometimes it looks very heavy and unnatural. You can look kind of like very monkey-like, sapien. We don't like that. So I take this approach when I inject. I start from the outside and high, kind of like you're pulling back a window curtain.
Okay.
So now that I take the time to explain to people why I'm doing it, my patients trust me to inject that way instead of saying, well, why don't you just inject where I want you to? So I've learned to, take that and gain confidence in that I'm the professional. I'm going to educate. And, we have a back and forth conversation.
Okay, great answer. I appreciate that. And thank you for being so informative. One of my questions also, I know I have some stuff written off, but some of the things I drift off on is so I was paying attention to one night when you were speaking to someone where you had stated that as you get Botox, and correct me if I'm wrong, as your treatment moves on, you need less and less when your treatment goes on.
Mhm.
Now, I'm kind of confused by that. Can you explain that, please?
Sure. So, as I was explaining, your relationship with me or your injectors is a journey. So, just like you go to the gym one day, that's fantastic. But the more you go to the gym, the better it is. And there's also things that you need to do at home. So, when we give Botox, we're basically paralyzing those muscles. So, remember back to that analogy when I said, like,
Whoa, 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 whoa. Go back a second. You said paralyzing. Should I be in fear of something paralyzing me? So
um,
when you use a phrase like that, I think I get a little scared of that. What do you actually mean by paralyzing?
well, Felipe, Botox is a neurotoxin, so it paralyzes your nerves. But using the appropriate way and the appropriate amount, we can just weaken the muscles.
So I'm sorry for interrupting again. When you're saying it's a neurotoxin, correct?
Mhm.
Is that bad for my system? Could that go into my blood? Can that cause something else to my system?
It stays exactly where it's injected. Will maybe move like a few millimeters, which we can talk about later with side effects, but it goes right into the muscle. So an experienced injector will target right into that muscle. So it's supposed to stay right there. It doesn't go into a bloodstream because you're not putting into a blood vessel. It just stays in that muscle. And I guess I would say, weakens when you paralyze. That's when people have the frozen look. So it's going to
Okay.
weaken it. So it's basically like, let's say that your forehead muscle, your crow's feet muscles are like your bicep muscle, and you're lifting a weight. Okay. So
Okay.
now it can no longer do that. It's not working out. So when you give someone Botox, it's going to weaken their muscle and they're not going to be able to use it. So over time, that muscle is going to get weaker and weaker if
Excuse me.
you do that journey where you come in every 3 to 4 months, and before the muscle gets stronger again, you put more in so the muscle can't get strong again. The mistake that people make, though, is they wait till it's completely worn off, they have full movement, and that's where we have to give the same amount. But if you're
Start all over
start all
again.
over again,
Okay.
exactly.
So let me ask you something. I found that pretty interesting when you had spoken about re-injecting and things like that. So you just made me think of a question. So if I'm a nurse practitioner or somebody that's not a doctor, am I allowed to inject you? Or do I have to seek the help of a doctor in order to make sure that they're following the procedures? How does that actually work? Could a nurse just turn around and start shooting Botox and make that decision?
I'm going to be honest with you, Felipe. I'm not sure about nurses. I do know that in Massachusetts, and I say Massachusetts because the laws, of course, are different than New Hampshire. But I myself am a medical director for nurse practitioners. So it depends on how long they've had their degree for and such like that. But sure, a nurse practitioner can inject, or a physician's assistant can inject.
Without having a doctor's knowledge or anything. Like they could just turn around. I just graduated PA school and I just said, you know what? This doctor does it at this price. I'm going to undercut that price and then I'm going to inject. So there's no time limit. There is no law. There is nothing saying that a novice like me could just go and get a medical degree and just go shoot in your face. And what's the average cost for Botox?
So I would say it starts, maybe if you're getting gesture 11s done, around $300. And then
And what's your 11s?
the 11s are the lines between your eyebrows. I don't really have any because I've been injecting myself since
It looks
2006.
great.
Thank you.
I'm not just saying that because you're my wife.
But the only problem is then people can't tell when I'm mad at them, like you.
Yes. No. We got to bring that into this now.
So anyway, yeah. So the nurse practitioner has me as a medical director in case something fate goes wrong. So I'm like their backup, or they can like come to me for advice, or they need my expertise and things like that. So they can inject, but they will have a medical director who is a medical physician oversee them.
All right. Okay, great. So I also wanted to discuss longevity. How long do the results of a Botox fillers typically last? And what can patients do to maintain their effects?
It's a really good question, Felipe.
I'm prepared for you. Trust me.
Um,
I'm on it.
So to put it simply, I would say that my Botox clients, their Botox lasts about 3 to 4 months. And the reason I say my Botox clients is because when I do inject, the end goal is a natural look. Most of my clients want a natural look. The more Botox you get, the more.
And I'm sorry for interrupting. When you're saying natural looks, can you give us an example of what's not natural?
So like for example, like I was joking about my 11s, but I can still knit my eyebrows, I can raise my forehead. So to me, that's considered natural when you still have movement. Um, Unnatural to me, and what other people consider unnatural, is a frozen look. So, well, when you see people on TV, like some newscasters, they're trying to make a face, their eyebrows aren't moving. They're trying to raise their eyebrows and they just can't.
Okay.
So to me, that's a frozen look. So that is achieved by more Botox. So because you're getting more Botox, they're frozen. So back to that analogy of lifting a weight, you
Yeah.
can't even lift that weight at all. That muscle is not working. It's totally locked out, knocked out,
Hence the term paralyzed,
paralyzed.
paralyzed from movement.
Yes. So
Okay.
it's going to last. For those people, it might last 6 months.
Okay.
But most of my clients prefer to come in more often for less Botox and more natural look.
Okay, great.
I'm not done answering your question.
I wasn't stopping you. I was just saying great. It's okay. What do you think about that, Robbie the Robber?
So you asked, and then Juvederm, depending on the area that's injected, will last about a year. My patients laugh at me because when they say they're getting lips injected, they say, Dr. Warren, how long is this going to last? And I say, it's going to last about a year, but it depends on how much you use your mouth. The more you use your mouth, the faster it's going to be worn off because you're breaking it down.
So you're saying people that smoke?
Absolutely, it's going to wear down faster.
It's
And
gotta
also,
wear
it's
that.
going to create
Stop smoking.
smoker's lines. So other things that people can do. So like I said, this is a journey and a process, and going to the gym is great. Coming in to see me for injections once every few months is great, but there are things that you should be doing every day, like getting plenty of sleep. I personally sleep 8 hours a night.
That's a lie. It's 12.
Drinking plenty of water, using good skincare, staying out of the sun, um, not sleeping on your side. When you sleep on your side, you're constantly wearing down that side. I can usually guess what side people sleep on when they come in, because they have more volume loss on that side. So these are all things that you can do at home to maximize your treatments just by taking better care of your overall health.
Great suggestions. I appreciate that. Excellent. So one of my other questions is, how do you educate your patients about the differences between various fillers and injectables?
Between various fillers?
Yes, and injectables.
What do you mean by injectables?
So I refer to Botox. Once again, I'm a novice as an injectable. So how do you turn around and say when someone goes, I want Botox, I want Botox, like where does fillers go and where do injectables go? Which I should say Botox go. Is there a different area that you use those two?
Oh, right. So injectables to me means anything you're going to put in your face with a needle. So
Okay.
that would be a neurotoxin, which Botox is a brand that I use. And then there's dysprosium and there's like many other neurotoxins. And the reason I stick with Botox is because I've become very familiar with it. So, for example, if go through someone's face with a needle, I know exactly how far it's going to spread. So to decrease side effects. So I've just become very familiar with it.
Okay.
And then with fillers, which is like I said before, kind of like the gel that you felt,
Yeah.
there are many different what we call G prime. G prime explains the thickness or viscosity. I forgot to bring, well, it would be hard for people to appreciate through visual, but it has different consistency. So for example, now we can contour the jawline and the cheeks. That has a much higher G prime, so it's like very thick, and it's like we're reconstructing like your bony structure almost. And then something that's on the opposite, that's much finer, is like Volbella, which is very fine, so we can use that under the eyes. A good example, for example, is the lips. So when people come in, they say, I want my lips done. I want to make sure that I understand what it is they're looking for. Are they looking for volume, which would be something with a bigger G prime, a little thicker, or do they just want softness? They don't want volume. They just want to smooth the lines. So nowadays we have so many options. Back when filler came out, we only had collagen. It was crazy. It was like very thick, not moldable. We didn't really have any great options. That was it. But now I compare it to like an artist with different paintbrush thicknesses. I have a whole palette to choose from. It's fantastic.
Great. I appreciate that.
I know we have
What I'm going to do,
comments or questions.
yeah, no, it's just people saying things. But since you're so inviting, since you can't see anyways, what I'm going to do is I'm going to take a pause for a minute because I do have a bunch of other questions before I end. Does anyone online have any questions that they would like to ask the doctor while we're still on?
I can't see my Instagram.
Robbie the robber can look.
Why?
People are joining, but no questions on there.
Okay, any questions? Any questions? Anybody want to know anything? Well, feel free to ask because I'll keep going. So when I'm going to go into the I want to talk about misconceptions. Okay, what are some common misconceptions? Mixed la 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 la. It's that accent. Misconceptions. Ooh, there's a lot in that, huh? More than 2 syllables. God, about Botox and fillers that you have encountered.
I'd say the most common thing I get when trading, because I not like them, try and feel out what their experience was. So I had this one woman, she said, yes, I had Botox for the first time 5 years ago and I hated it. It was the worst thing that ever happened to me. And I was like, what? And she still wanted to get Botox from me. So I said, well, what happened? And she said she was getting married. She never had it. She went to a medical doctor, a dermatologist, 3 weeks before her wedding. And on the consent form, it says that one of the side effects if you get Botox in your 11s is you can have a lid droop. So I said, oh, did you get a lid droop? She goes, did I get a lid droop? She said, no. She goes, my whole eyelid closed. And she said, no, she had to wear a patch for a wedding and she didn't have any wedding photos. And
I couldn't understand why she wanted again, but she said, I understand that these things can happen. So she's like, I did my research. I see that you've been injecting for a long time. So she said, I'm going to take another chance with Botox, and I'm taking my chance with you. And you're right. Um, so I thought to myself, wow, this is fantastic that she's coming here, but it's a lot of pressure. So I did just a small amount on her. And even though I've been injecting for 18 years, I always go back to the basics. I always still mark my patients. And I actually had a client say that the other day. They're like, oh, you use a marker and you mark where you're going to inject. They said the last person they went to just came at them with a needle. But it's really important. It takes only millimeters difference, and you could end up with a lid droop. So yes, I just never skip any steps when I inject with filler. I always make sure I aspirate not in the blood vessel. Oh, I'm digressing. Sorry. Um, so first time what regrets, don't make a quick decision before, like, don't do it because you have a wedding in 2 weeks. You could bruise a lot. I had another patient who came in and she had 3 babies, C-sections, and she ended up having a condition called von Willebrand's disease. Are you familiar with that?
Absolutely not. How about you, Robbie the Robber?
Von Willebrand's disease is when you don't have a clotting factor, so you can't stop bleeding. Okay. So you just keep bleeding. So
scary.
Yes, very scary. You could potentially bleed to death. So usually it's found in women who have really heavy periods or they have childbirth and they don't stop bleeding. But anyway, this woman came in for injections and I did her fillers. And usually when I inject people, I'm pretty gentle and there's no bruising or anything, but she bruised a lot, like excessively. And I thought, this is not normal. And I'm not her regular medical doctor. So I said to her, you need to go see your doctor and ask to be tested for a clotting disorder called von Willebrand's disease. And she did, and she came back to me. She said she tested positive, which is crazy.
Wow. So that was a great find on your half. Without the knowledge of you doing that, her medical doctor wouldn't have known.
Right. So now anytime she goes in for surgery, it was really great that we picked that up. So she has to let the surgeons know because she's just going to bleed out more easily.
Okay. Great answer. Long answer, but great answer. All right. So I'm going to talk about the costs and accessibility. So how do you address the financial aspects of these treatments, especially for those who may feel they can't afford them? So I always hear people saying, oh, I want to get Botox, but I can't afford it. It's so expensive. But then when I hear the cost of it, and I'm thinking to myself, well, $300 to get rid of lines off my face to make me feel better. And for 5 to 6 months, geez, I'd give up a donut or I'd give up a beer for it. I'm just trying to figure out, how do you figure it? How do you discuss it?
Again, this is something that's taken me time to get more confident with. So what I would say is, like, if you don't have the finances, that you should hold off and save money till you can get it treated. I used to have people come in and say, well, I only want to spend $250. And in the beginning, I'd be like, okay, well,
is there a limit on that? Could someone come in and say, if you walk in and I'm like, damn, that girl needs at least $2,000 or guy needs $2,000 worth of face treatment, and they come in with $75 and go, this is what I need, fix it all.
Right.
How does that make any sense?
So again, that's where I have to go back and say to myself, well, I'm the expert. So it's like having someone come in, a plumber, and saying, you're going to need to purchase this because it's a better product and ultimately it's going to last you longer, where you're going to be happy with the results.
I'd like to just interrupt and interject. Brian Doherty, this is nothing to you, man. We love you, bro. You're the best plumber we know.
But so in the beginning, when I didn't want to say no to people, I would just say, okay, we'll do it. But then I realized I wasn't doing anybody favors because that wasn't enough, that they needed to get an adequate result. And then they felt like I didn't do a good job. So you have to remember this is an elective procedure. And what I will tell people is if you don't have the money, it's better if you save up and then come in and then we can treat you to get the best end results that you can get. Because, for example, filler is $800 a syringe. You might need 3 syringes. And if I only do 1 syringe, you're not going to be happy with the results. You're gonna say, well, I spent $800 and like nothing happened. So I have learned over time to say, listen, I write up a treatment plan. This is ultimately what you're gonna need. This is the cost, and come back and see me when you're ready.
Great advice. Great advice. Well, Dr. Wong, I would like to say from my personal experience, besides marrying you and being blessed with that, I personally get Botox done and have been very happy with my results. What would you say to someone who is considering these treatments but is still unsure, as I did? And I'm not going to lie, everyone, I got Botox just to meet her. And she yelled at me and said, "You don't need it." And I dropped $500 down and I said, "Well, put it any way you want." So that's how we met.
And how did that work out?
I guess we've been married now. So we've been together close to several years.
We've been married for 1 year.
Well, yeah, we've been married 1 year, known each other for almost several years.
I think Robbie's laughing.
I got the same problem. So.
Yeah, Robbie and the Robber and all the gentlemen that are online with us understand we never get the dates correct. So stop the nonsense.
Well, why don't you show off your forehead?
So also, I'm not bald. Somebody keeps saying, "Felipe, are you bald?" I just like wearing my Templar hat to respect God. So here's my face.
Wow, that's a smooth forehead.
Why, thank you. My wife
Can you
did
raise
it.
your eyebrows? Oh, okay. Maybe, yeah, it looks pretty good.
Why, thank you, Dr. Wong. By Radiant Medispa, and I get facials there. I love them.
Yes, he does.
Tony, don't take that any other way.
So anyway, so advice for people who want to try it out.
Yes, please.
So I would say definitely do your research and find someone who's injected a lot, like someone who's been injecting for either many years or who has a high volume and has been doing a lot. Secondly, I don't recommend going for the cheapest price. There are people who just call our office and their first question is, how many dollars a unit is Dr. Wong's Botox?
So wait a minute. So you're saying someone like just drops calls, but yet they don't look at the experience. They just say whoever's the cheapest. So you can get someone that calls up and say, "Hey, it's $10. Okay, I'm going to go with that," but not even looking up to see how experienced that individual is. Because I know for sure that I've basically sent you people that have gotten taken care of somewhere else that you've gone and corrected, but yet they still went back to that person or a lousy $2 fee difference for a lousy $2 to have somebody else, but yet they go to you to fix and then they go somewhere else back to that person.
Yeah, I've heard that. They were coming to me and I appreciate the referrals, but then they went somewhere else because they were like, oh, they were cheaper by $2 or $3 a unit. And they said, but in the short end of it, they actually ended up spending more money because they had to go back to them to get things adjusted, or then they had to come to see me anyway to get things adjusted. But you know, in the end, yeah, it's not just about price. You want someone with experience. Even if it's a nurse practitioner, physician's assistant, just someone with a lot of experience. And you're right. It's if you do 20 units here, in your 11s, the difference is like $60 and this is your face.
Yeah, that's something that's your face. It's not a car. It's not changing a rim. It's not something you can fix for that moment. You'd have to see a professional like you, correct, to dissolve it, I believe you call it, or whatever it's referred to.
Yeah, well, with the Botox, nothing can be done. You just have to wait for it to wear off.
So you're talking 4 to 5 months, possibly.
Yeah, like you could have a lid droop and you just have to like live with it.
I would like to tell a personal story. One day, Dr. Wong decided to let a PA touch my face. And
well, it doesn't matter it matters that they were in training and they didn't have the experience.
I would just like to point out my story. And I had a droop and I didn't notice it. And one day she looked at me and said, "Oh my God, your eye is drooping." And then all of a sudden I go, "Oh my God, did I have a stroke?" Because I was nervous. And she goes, "No, it's from the Botox." So I was very upset with her at that time because I'm so used to having her do it. that she decided to donate my face to someone else. And it was not a good day. And thank you, Tony. I see Mr. Rodriguez, my primo man. All good. Thank you. Thank you for the comments.
In my defense, I was overseeing this provider and I told her where to inject it, but she did not listen to me and decided to make her own decision. And that this is what I was talking about. These minor millimeters can make a big difference.
So I know personally, I wouldn't bring my car that my wife drives to another person's shop unless I trust them, because I want to make sure that the wheels stay on and everything. So I stick with my compadres. I stick with my team. So my wife should have just stuck with me. And you can write the comments for that for all my fellows.
But I believe in education.
By using my face,
they have to practice. And I was.
We can always use Robbie the Robber.
He doesn't.
Yeah, get the mask. Yeah, that's fine.
He wears a mask. He doesn't need it. We can't see his face.
Tony says 100% to me. So there's an agreement. So listen, everyone, I really like to appreciate the time. I just want to close out with also Dr. Huang. Also, what can I say? Thank you so much for everyone that joins us. This is called the Security Tales, and we will be having security conversations and things like that, and political things, everything we're going to touch base on. I wanted my wife and Dr. Huang also to join us, because a lot of my friends and a lot of people have been asking and inquiring about Botox and fillers. There's no embarrassing in it. Everyone now is doing it. Dr. Huang, would you like anything to say in your closing?
No, this has been fun. I feel like there's so much more I could talk about. So,
Listen, if you're all interested to have her back, please, you can inboard message me. You can go to @Security Tales and put your comments there and become a subscriber. And whatever anyone wants to talk about or know, I am connected to so many different people that I've been blessed in my life that they will gladly come on aboard. I see my boy Tony Champa, and Tony's been on. He's basically ran restaurants, he could tell us all about that stuff. I have so many outlets that I'm so interested in letting people know the directions that we should go to. And I would love to have Dr. Huang back on again to discuss even more. She is also very well experienced in her new treatment that was brought into her practice. You want to just touch base with that before we go?
Are you referring to hormone replacement therapy?
Yes, I am. For you gentlemen and ladies, for the guys that their testes have gone down, this is where it's at.
Oh, well, I did it kind of
Shorts.
Huh?
A short spiel.
Short. I did it for selfish reasons because I turned 51.
Oh my, she turned 51.
I turned 51. So anybody who is lacking energy, has brain fog, decreased libido, a joint pain, can benefit from hormone replacement therapy. We draw your blood, we customize it to you, and we insert these pellets that go right under your skin, and you'll feel fantastic, men and women.
Women with estrogen imbalance and things like that also, correct?
Yep.
Definitely. Yep. Please feel free to go down to Radiant Medi Spa, located at 955 Main Street, Winchester, Mass. Ask for Dr. Huang. Tell them Security Tales sent you, Felipe. Thank you so much for everyone joining us. I hope you all have a blessed day and be blessed and health with you and your family. Thank you once again, everyone. Mad love and respect.